The LeEject needle and syringe system is a dental safety device designed to prevent needle stick injuries. This new technology requires a learning process, so please become familiarized with the LeEject system prior to use on patients. Practice the following 8 steps on a flat, broad surface with ample light. The sharps container should be readily available to all treatment areas and within arm reach. All sharps should be discarded after each use immediately. The treatment tray should be kept tidy as possible as the treatment progresses. The trash-like gauze should not pile up in the treatment trays. Discard the used needle after injections are completed. If more injections are needed later, then use a new needle. Insertion of an anesthetic cartridge. While the plunger is pulled, the cartridge can be placed either from the needle or harpoon side. Insertion of the LeEject needle. Twist off the seal and remove the short cap. While the plunger is pulled and the syringe is pointed upward so that the cartridge would slide down the harpoon, insert the needle into the syringe and gently guide the needle into the cone receptacle as the plunger is released. Great care should be taken so that the shorter needle penetrates the center of the cartridge diaphragm. If the periphery of the diaphragm is pierced, then the solution may leak during injection. Manual aspiration. Gently tap the thumb ring so that the harpoon would engage the rubber plunger of the cartridge. Remove the long protective cap just prior to insertion of the needle. Aspirate before anesthetics is injected. Removal of the empty cartridge. To remove the empty cartridge, disengage the harpoon from the cartridge by pulling out the plunger in a smooth and rapid motion. Push out the cartridge through the small window underneath with your opposing index finger. Pick up the empty cartridge with your thumb and index finger. The harpoons in the new syringes are designed to disengage the rubber plunger of the cartridge, even when the thumb ring is tapped too hard. Warning: if the plunger is pulled in a rough and jerky motion, then the needle could fall out of the syringe. If the needle falls out of the syringe, pick up the needle with a hemostat or college pliers. While removing the cartridge, the syringe should be kept flat. If the syringe is rotated, then the needle would fall out. After completion of injection, do not recap the needle. If more injections are needed, insert another cartridge. If injection is completed, then discard the needle. Insertion of second cartridge. While pointing the syringe upward and pulling on the plunger, place another cartridge from the harpoon side. The second cartridge can be inserted while pointing the syringe downward. Make sure that the cone of the needle is in the center of the cone receptacle of the syringe. Insert another cartridge from the needle side. Self-aspiration. Aspiration should be done manually. The self-aspiration is a safety backup system. Self-aspiration occurs when pressure of the injection is released. The cartridge diaphragm springs back against a little bump at the short needle, thus creating a negative pressure in the cartridge. Without tapping the thumb ring, inject first a few drops of local anesthetic, then stop pushing and pull back the thumb ring. Inspect the cartridge for the presence of blood. If blood is present, withdraw the needle halfway, redirect, and insert the needle. Inject a little of local anesthetic and aspirate again. By definition, a little amount of fluid has to be injected before self-aspiration works. If that little amount of anesthetic containing epinephrine were injected into bloodstream, then patients would feel heart palpitations and could be dangerous in certain patient populations with compromised cardiovascular problems. For reference, see Appendix 4. Warning: self-aspiration should not be used with local anesthetics containing epinephrine or other vasoconstrictors, or used on children under the age of 12 and weighing less than 100 pounds, 45 kilograms. All local anesthetics should be injected slowly for the patient's comfort and safety. Needle stability in the loaded syringe. The needle by itself is not stable in the syringe. A cartridge must be added for the stability of the needle. During injection, force of the injection further stabilizes the needle. During the inferior alveolar nerve block injection, a rotating force is exerted. Even if the loaded syringe is dropped over 2 feet, the needle would not be separated from the syringe. Disposal of the used needle, self-release. After completion of injection, do not recap the needles. Remove the cartridge first. Position the syringe above a sharps container and rotate the syringe 180 degrees so that the needle falls off into the sharps container directly. If the needle falls off inadvertently and not into the sharps container, do not pick up the dropped needles with hands. Use college pliers or hemostat to pick up and discard the needle into the sharps container. The sharps container should be readily available within arm's reach. The inadvertently dropped needle should not be picked up by hands and should be disposed immediately. Thank you for watching our training video. For further information, please visit our website at www.LeEject.com.